Hi, everybody. This is Dr. Lad McNamara. We're going to talk about vitamin K2 today. Why boost your levels? We're going to talk about it, the benefits of it. What is it? Why to take it? Boost your levels anyway. And I've labeled it as the missing link. The missing link because the link between what? Link between micronutrients and better health. Today's a generic presentation. I'm not talking about any particular brand, but just in general, the vitamin K2, so have a better understanding of it. Vitamin K1 and vitamin K2, most people are familiar with vitamin K in the sense of vitamin K1, but vitamin K2 is very important and probably much more critical to what you would be interested in. K1 has to do with, comes from plants. Vitamin K2 is produced in animals and mostly in animal fats, and including egg yolk, but also fermented foods would produce vitamin K2. And then we look at vitamin K2, there are many forms of vitamin K2, and the most important ones we talk about are MK4 and MK7. Some of you, or most of you, are familiar with ubiquinone, as CoQ10, and this is a type of quinone, menaquinone. That's what the MK stands for. Now, vitamin K, the K got the name for coagulation. Vitamin K1 deals with blood clotting. In German, coagulation is spelled with a K, and that's why the letter vitamin K came up. But when we look at, think about vitamin K2, there are some things to consider with vitamin K2 particularly in regard to warfarin, which we'll get to at the end. So I will answer the question about whether you can take vitamin K2 if you're on warfarin or Coumadin, a blood thinning agent. The main thing that vitamin K does is this: it regulates calcium in the body, and calcium has to do with it plays a role in cardiovascular disease. Also, calcium is very important for the bones, as you know. And there are people who develop kidney stones, and there are different types of kidney stones, but kidney stones that deal with calcium accumulated in these stones, so that's an issue. We look at atherosclerosis. Most people die, well, at least half the people will die from heart disease, right? Atherosclerosis. You get plaque in your arteries because of increased calcium. And a lot of people are focused on cholesterol, LDL cholesterol. Did you know calcium plaque in your arteries is 95% made of calcium and only 5% made of cholesterol? So, but yet we go after all the cholesterol. Cholesterol is the bad thing. Let's just destroy cholesterol, get rid of it. Well, you need cholesterol, you need LDL cholesterol. But when you look at plaque in the arteries, 95% of it is calcium. The calcium building up in your arteries is the problem. Calcium building up in the arteries of the coronary arteries will form the plaque, and you'll have a heart attack and may die. Not good news. Or have a stroke, or the calcium accumulates in your aorta or anywhere else in your arteries. As a matter of fact, even on mammograms, women can see benign calcifications. The benign calcification means it's not cancer, but guess what it is? The calcium deposits in these small arterioles in the breast tissue you're seen as calcifications. That's an indication of coronary artery disease. So just something to do with it. Vitamin K2, and particularly this MK4 and MK7, remember, MK4 is particularly important in this calcium regulation into the bones and the arteries, etc. But MK7 is a better form of taking it. We'll talk about that as well. So what does studies show? The studies show that if you increase your vitamin K2 intake, it will decrease the risk of heart disease and decrease the risk of death from heart disease. That's what the studies show. As a matter of fact, there was a 7-year study involving 4,800 people, and it showed that if people took much higher doses than 32.7 micrograms per day, higher doses than that, we're talking about 100, 200, 300, 400, even higher, of vitamin K2, there was a over a 50% decrease in death from heart disease. That's huge. To cut your risk for heart disease, death from heart disease, in half, simply associated with increasing your vitamin K2 levels. And there was another study among over 16,000 women, for every 10 micrograms of vitamin K2 that they increased, for every 10, they decreased their risk for heart disease by 9%. So how much more would you boost your vitamin K2 intake to get an extra 10% decreased risk on heart disease? That means less calcium deposited in your arteries, boosting all the way up to where you can get a greater than 50% decreased risk in death from heart disease. Sounds like something you might want to take or add to your daily regimen, right? I think so. What about osteoporosis? Osteoporosis is a big issue. Mostly occurs in women after after they go through menopause, but it can occur in men as well. And there's a lot of drugs for osteoporosis, which have a lot of side effects and problems. Did you know that vitamin K2, it activates calcium binding proteins in the bone? It stimulates those proteins that takes the calcium and puts it into the bone. The MK4 is a much more powerful form of it, but the MK7, it has an important role as well and is a better form to take, which we'll talk about in a few minutes. Of 244 women in a 3-year study, shown that those women who took higher doses of vitamin K2 had less bone loss. Their bones were better. In other words, they didn't lose as much bone over the 3 years of time as the women who were just on a placebo. As a matter of fact, the vitamin K2 showed that there was a greater than 60% decreased risk in spinal fractures, 77% decreased risk in hip fractures, and 81% decrease in other fractures in the body other than the spine and the hip. That's huge, particularly when you talk about the fractures that can lead to other problems, or like DVTs, the blood clots in your legs, and then go to the lungs and cause pulmonary embolisms or pneumonia because you're laid up in bed from the hip fracture. Bottom line is this, I made a picture for you. The vitamin K2, it takes the calcium out of the heart and arteries and drives it into the bones. That's pretty much all you need to remember for the most part, right? That's a huge benefit. Strengthens the bones and takes it out of the arteries and heart, because calcium in the arteries is not a good thing. Well, there are other research out there that shows that there's some hints at this. I'm not claiming this is what it does. I'm saying there's hints at the benefits of vitamin K2 in that in liver cancer recurrence could be reduced, increasing the survival in those with liver cancer. There's also studies, or at least epidemiological studies, that means looking at the population. Those people with prostate cancer, the men with prostate cancer who boosted up their vitamin K2 levels had decreased recurrence of prostate cancer. That was a study, that was in looking at epidemiological studies of over 11,000 men. So there's hints at that. Nothing's been proven, but there's just suggestions that there could be benefit. When we take vitamin K2, we also want to be able to synergistically use it with vitamin D. Those two go together. So to boost up your vitamin D level without boosting up your vitamin K2 level may not be beneficial, but boosting up your vitamin D and your vitamin K2 is very beneficial. As a matter of fact, vitamin K2 is the new vitamin D, right? Orange is the new black. Well, in your food, again, in your food, you're getting vitamin K1. You need it. It's important to have blood clotting factor, activate your blood clotting factors, although you don't want to bleed to death. But vitamin K2, which is not very plentiful in most people's diets because most people don't eat organ meats. Unless you're eating liver all the time, then you're not getting very much of it. And then it's mostly in fatty meats. The lean meats don't have as much vitamin K2. And fermented foods have the vitamin K2 as well. And of those, the MK4 form of it is in the meat. The fermented foods like fermented soy, natto, things that will produce MK7 of the two. Just FYI, if you want to know. So what else you want to know? Well, who should take vitamin K2? Who should boost up their levels? Well, anybody who's concerned with heart disease or supporting their heart health. Anybody who's at risk for or has osteoporosis or concerned with osteoporosis. And possibly, you can think of people concerned who has cancer or concerned with it. That's not known, but something to think about. What about a history of kidney stones? There are certain types of kidney stones that have to do with it because not all kidney stones are the same. So if people have had kidney stones, would it be beneficial to increase vitamin K2? There's some that suggest this might be the case. There's nothing been proven about it, but it wouldn't hurt. Well, breast calcifications in the breasts. I've seen this in my medical practice, driving it from the benign breast calcifications driving to the bones. When I had women who had mammograms that showed the benign breast calcifications, I would put them on very high doses of vitamin K2, and within 3 or 4 months, definitely by 6 months, the calcium would be gone out of the breast tissue. And that would mean that it was gone out of the rest. You can confer, or at least infer, or conclude that it was probably driven out of elsewhere out of the arteries as well. So what dose is ideal? What dose of vitamin K2 should you be taking? Well, there's some considerations. If you're taking a quality vitamin antioxidant supplement daily, you're getting 240 micrograms of vitamin K1, and you're getting 30 micrograms of vitamin K2. That's okay. That's pretty good. It's better than most other supplements, and this is a good foundation. I would suggest that would be your minimum of a good quality supplement. It doesn't mean you're deficient. It doesn't mean it's pathetic. It just means that's a good base, a very good base for maintaining supplements. And then you could also be getting more in your separate vitamin D. A good quality vitamin D supplement would also provide a vitamin K2 in it as well as a magnesium and calcium supplement. That you're going to get more vitamin K2. In my practice, remember I said with women who had the breast calcifications, I would give them 2,000 micrograms of vitamin K2 a day. 2,000. It's a lot more than 180 micrograms. Is that toxic? No. In a 2-year Japanese study on osteoporosis, they were giving the women 45,000 micrograms of vitamin K2 a day. 45,000. That's when they saw the significant decrease in fractures. And that's important to note, is that although you can increase bone mineral density, the whole kit and caboodle there is decrease the risk of bone fractures. My point of this is, the only point of that is not to tell you to take 45,000. The point of telling you that is that vitamin K2 is safe. It's extremely safe. As a matter of fact, 45,000 micrograms, that would be like taking a bottle. If you happen to have vitamin K2 at 180 micrograms per day, capsules or tablets, whatever, and you would have to take over 100, no, over 200, and you still wouldn't hit 200 of those capsules per day, and you still wouldn't be reaching 45,000 micrograms per day. So point is, it's very safe. That message. All right. Well, the United States recommended dosage of vitamin K. So the vitamin K. Oh, this is for vitamin K for men is 120 micrograms, and for women it's 90 micrograms. Well, I don't go by that, so let's just throw that away. Because we're talking about optimal health, right? Ideal health, true health. We're not talking about those low levels. Osteocalcium. Oh, excuse me. Osteocalcium, excuse me. That's a bone. Well, that's a hormone. That's a protein in the bones that help with bone mineralization. It's maximally activated with around, you're getting about between 1,000 and 2,000 micrograms of vitamin K2 per day. Again, so if somebody's dealing with osteoporosis or has had a bone fracture, you might want to consider boosting up to these levels. So taking an extra 180 micrograms per day is not a problem. It's not toxic. You're not even close to toxicity. You could take 100 of those capsules a day and you wouldn't be close to toxicity. Here's some food for thought. Optimal doses, consider this. For vitamin K1, at least 270 micrograms per day. Some people when they go up to therapeutic levels, they're hitting 4,000 micrograms a day or more of K1. I'm not suggesting you do that. I'm just saying the more optimal levels. Optimal levels in the low end of vitamin K2 would be about 90 micrograms per day. And then again, at maintenance level, so anywhere between 200 and 1,000 micrograms a day. So if you were taking a foundational product that had 30 micrograms of vitamin K2 plus an extra capsule of 100 micrograms, 180 micrograms per day, you're getting a little bit over 200 micrograms of vitamin K2 per day. That's great. That's a good foundational maintenance dose. Therapeutic doses are going to be up in the higher ranges, and there's no problem with that. Of course, talk to your doctor before you do anything. Make sure it's right for you. 180 micrograms of vitamin K2 in the MK7 form to add to your foundational supplements is ideal for maintenance of good health, good heart health, good bone health, good brain health. In the body, MK4 is going to be greater than MK7 because MK4 is made by the body, in the vein of the body. MK7 is made by the bacteria. But for when you consider bone density, MK4 works better than MK7, but here's the caveat. MK7 is more bioavailable than MK4. As a matter of fact, for sustained blood levels of vitamin K2, MK7 is much greater than MK4 in sustainability, bioavailability, and sustainability in the blood. As a matter of fact, when you look at the bioavailability of MK7, so when you take it, in the first 8 hours, it's going to peak. Both MK7 and MK4 is going to peak. But then after 16 hours, MK7 is going to come down, but MK4 is barely around. So 8 hours, 16 hours, by 24, it's not around, but MK7 hangs around for a little bit. You see that? MK7 is sustainable in the blood. And why would you want the MK7 when MK4 is much more effective at stimulating the bone mineral density and also taking it out of the arteries? Because MK7 is sustainable and it converts into MK4 at the levels the body needs. So it's going over to the level, it's there as a reservoir. MK7 has the effects, but it also, since it converts to MK4, it then keeps those effects sustainable. And that's why MK7 is a preferred form. Although it is true that MK4 is the one that actually performs most of those effects, MK7 has the sustainability of those effects. Hopefully that makes sense. And here's something else. MK7 activates anti-nuclear factor kappa B activity. Well, that anti-nuclear factor, NF kappa B activity, it inhibits abnormal cell growth. It inhibits angiogenesis, the creation of blood vessels to feed abnormal cells, a clump of abnormal cells that can grow and metastasize. It impedes invasion of abnormal cells, and it impedes metastases of abnormal cells. That's what that does. MK7 activates it. That's why these epidemiological studies are saying, hey, there could be something here. Now, what about warfarin? I promised you that. This is the in conclusion part. The warfarin is, of course, also known as Coumadin, is the brand name, and it has a blood thinner for people who've had history of deep venous thrombosis, DVTs, or pulmonary embolisms, or risk for that. And they'll get on a blood thinner. And so the doctors for years have been saying, don't take vitamin K because the vitamin K will interfere with warfarin or Coumadin. Well, yes, it does, but the bottom line is vitamin K1 and 2 are safe to use with warfarin at moderate doses. As a matter of fact, vitamin K1 and 2, mostly vitamin K1, stabilizes INR control. So when people are on warfarin or Coumadin, they're having their blood levels checked, they're having their INR checked. What's the INR? The INR is the international normalized ratio of what's their bleeding times, essentially. How long does it take them to clot? Because when you have your risk for clots, you'll be on Coumadin, or which is warfarin, and they want to have an INR ratio between 2.0 and 3.0. That's the target range, the therapeutic range for that when you're on warfarin or Coumadin. Well, a lot of times what happens is, since they're not taking any vitamin K K1 or K2, their INR ratios are like all over the place, and the doctor's trying to give them a higher dose, lower your dose of warfarin, higher dose, lower, because it's going all over the place. They're chasing it. What vitamin K1 and vitamin K2 does, it stabilizes the INR. It helps control it, so you're not all over the place. And by taking a little bit of vitamin K1 and vitamin K2, it stabilizes it, so it acts as a counterbalance, so it kind of keeps it more consistent. Now, the need for your warfarin dose, your Coumadin dose, might go up 10 or 15% need of it if you're taking it. But as long as your dose, your daily dose of vitamin K1 and K2 is consistent, it's helpful and beneficial to be taking it while taking warfarin or Coumadin. And although vitamin K1 is most directly affected in the clotting factors, there is evidence that if you take too high, well, not too high, when taking good high doses of vitamin K2, it will affect the INR ratio. That usually might start around when you go above 50 micrograms per day. But definitely when you're hitting over 200 micrograms a day, which you would be hitting if you're taking a good foundational quality supplement, along with an additional 180 micrograms of vitamin K2, you would be pushing it over 200. And the studies have shown that it does reduce your INR without changing the dose from 2.0 down to the subtherapeutic level of 1.5. That doctors won't like that if you're taking warfarin or Coumadin. So a little caution: if you're taking warfarin or Coumadin and you're taking if you're taking a good foundational supplement product without extra vitamin K2, you're good. But if you're going to take an additional vitamin K2, just know your INR ratio will come down. Now, the options are this: you can talk to your doctor about increasing the warfarin dose and staying on the vitamin K2. I didn't say that you shouldn't take it, it's that you just need to be aware of it will reduce your INR ratio. The studies show that. And therefore you might need just to increase the warfarin dose, but then you get the benefits of the vitamin K2. Those are the options. Well, the other option is not to take the vitamin K2 at all, but then you're going to miss out on some of the benefits. I'm not suggesting what you should do. I'm saying talk to your doctor, consult your doctor. I'm just giving you information of what you can work with. So in final summary, is that vitamin K2, it decreases calcifications of the arteries, the coronary arteries, the aorta, the brain arteries, everywhere. And therefore, it decreases the risk of cardiovascular disease, which means heart disease and stroke, etc. It also decreases the risk of osteoporosis and possibly diabetes and possibly some cancers and possibly renal stones and possibly many other things as well. Again, some considerations. Talk to your doctor about this, but make sure you take a high quality nutritional supplements, which is created from high quality raw materials, good manufacturing practices, and along with vitamin K2 and vitamin D3. Take it every day for life. Thanks everyone. Have a good day.